About 1 in 5 women struggle with infertility, according to the CDC. Infertility is considered when a woman can't get pregnant within a year of trying, and their chances are even lower the older they get. Dr. Adrienne Gentry, an infertility specialist, is joining me now with Baptist Hospital, and she's joining us for National Infertility Awareness Week. Good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
Can you just tell us, what are the common misconceptions about infertility?
There are a lot of misconceptions about infertility. One is that it's way more common than people think. Approximately 1 out of 8 couples experience infertility. And so that's probably one of the most common misconceptions. It's just way more common.
And what are some reasons for why women can't get pregnant?
Yeah, that's a great question. Usually I like to talk about it as a rule of threes. So about 1 out of 3 couples experience infertility due to a female factor. Whether she's not ovulating correctly, there's some type of damage to her tubes, something like that. The other third is generally a male factor issue. So either the sperm count is low, the sperm aren't swimming well, or the shape isn't appropriate. And then the third is usually a combined factor, so maybe a male and female factor together, or actually unexplained, meaning we can't find a reason why they're not getting pregnant.
And if you are trying to get pregnant, what should you do to maybe check and see if you might be having those issues before you start trying?
Yeah, that's a good question. So for a woman's aspect of it, so if she's not getting periods regularly, predictably, that's concerning that maybe she's not ovulating. And if that's the case, she should come see us right away. Other things could be, history of surgery, some type of pelvic surgery, which could be concerning for some type of adhesions, which could cause some scarring of tubes. So those are things where you might want to come see us sooner. I think the most important thing is a woman's age. So in women who are under the age of 35, you said it perfectly. If you've been trying for a year and you're not pregnant, you need to come see us. But in women who are 35 and older, if you're not pregnant after trying for 6 months, don't wait any longer. Come see us.
Is there anything that women might do regularly that might lead to infertility? I've heard, I don't know if this is accurate or not, but taking birth control for too long or anything, that you might be doing might lead to that.
No. And I think that's super important because women always blame themselves, and it's not their fault. Infertility doesn't discriminate. It doesn't matter who you are, what you do, what you're trying to do. It doesn't matter. So there's nothing that they can really do to prevent it.
And, we also mentioned men, that it does affect men. So what are some signs in men that you should look out for?
Not any sign. It's completely asymptomatic, if you will. Men have no idea if their sperm count is low or if there's any issues with their sperm.
And what are some options that people can do if they can't get pregnant organically?
So when they come to see us, we usually do a workup to kind of evaluate why they're not getting pregnant on their own. And then based on the etiology of their pregnancy, etiology of their infertility, meaning why can't they get pregnant, we have options where if the woman's not ovulating, we give her medication to make her ovulate. If there's kind of an unexplained, meaning we can't really figure out why, we sometimes just kind of help things along and do inseminations. And then the final kind of ultimate treatment is in vitro fertilization.
All right, and tell us a little bit about in vitro. What is that process like?
Yeah, the process is, although it can seem very kind of overwhelming, we are there with them every single day of it and walk them right through it. But generally what happens is women take injections daily for approximately 10 to 14 days. We then go and surgically retrieve the eggs. And then outside of the body, the eggs are fertilized with the partner's sperm. And then those fertilized eggs are cultured in the lab until an embryo. And then we transfer the embryo into the uterus.
All right, well, this is wonderful information. What would you encourage people to do if they want to find out more about infertility? Where should they seek resources?
Yeah, so as you mentioned, tomorrow starts the National Infertility Awareness Week. You can actually go to their website. It's NIAW. Lots of information there, as well as the American Society for Reproductive Medicine has a lot of great information for patients. I think the most important thing is that patients understand that they're not alone, that we're here for them, and we'll walk you through every step of the way.
Wonderful. Thank you so much, Dr. Gentry, for joining us this morning.
Thank you for having me.